public servants to be forced to use public hospitals. Hassan says that will be the best way to improve public health facilities because at the moment, the policymakers who make decisions affecting the hospitals rarely even go to them, even on fact-finding missions. The Kwale legislator wants the insurance policies that public officers have to be only used in public hospitals, and if they want to use private facilities, then they have to use their own money. She argues that if public officers, especially members of parliament and senior civil servants, are forced by law to use public hospitals, then there will be better oversight and better allocation of resources because the leaders will be able to closely monitor the operations of the hospital and will have an interest in them providing good health services. I'm now joined in studio by Dr. Simon Kigondu, who is a practicing doctor and a KMA treasurer, and also Honorable Francis Waititu, Juja member of parliament and also a cancer survivor. He's been advocating for better equipment in the country. You can also join the discussion at Trevor Mbija at NTV Kenya, and we start right now. Thanks for making time for us, gentlemen.
Thank you very much.
Honorable, do you reckon this will be the solution to the dwindling services in public hospitals?
Let me first start by saying
Yes.
that when one goes for checkup about cancer, cancer is never painful, and we have a doctor here. And when my sister was attacked by cancer, and I went to her husband and I asked the husband to allow me to live with her, but it was stage 4. That is now how she passed on. But later I also said, let my mom, who is now 86 years old, be checked. And when I took her to Aga Khan Hospital, she was told she has brain cancer, like the one that I got. And I went, took her to the hospital for 8 months. And luckily, it was stage 1. So now she's okay. And I said, maybe this is an inheritance of our family. Why don't I also go to be checked? And that is why even I was the first person, the first member of parliament to say I have cancer. When I was told you are now attacked by cancer. And I now had to be operated in Aga Khan Hospital. And after being operated, and I came and spoke about my cancer. But luckily, now what happens in Kenya is that we don't have these machines. And having us not having these machines is what made me now to go around talking with the Nyang and Senator Beth Mugo and me now. Because people don't want to talk about cancer. And it's better when somebody has malaria than even having cancer, or even cancer is easier for you to be cured when it's known. And the doctor is here, he'll tell you today. And that is what I understood when I went to India. Because we have over 9 million people, but 5 million are sleeping outside. Because we have done harambes for them, 3 million, 2 million, but they can't afford a house there. So they are sleeping outside. That is now why I went, and I even became the chairman there. And what I want Kenyans to understand, it's cancer is very easily treated. But now when we go and do harambes, Daktari, and now we raise about 2 million, 3 million, or 4 million. But that person goes now to be attended because you have radiotherapy has to be done every day for 5 days in a week. But even in Kenyatta, I went recently. They are telling you the machines are out of order. So somebody goes through radiotherapy for 2 days in a month, but sleeps there from Kakamega, from Kisumu, from Nyandarua, from every part of this country. That is why I have told the president personally, and he's supporting us with Nyang Nyong and Senator Beth Mugo, that we must work closely now with the county governments. Instead of them building houses for 28 billion, millions, I don't know for what, we need, because health is devolved, we want to work closely with them. Let them give us a little money, at least for checkups. There is now the one, Doctor, you know, which is now costing 9 billion, but not for treatment, to check. It tells you now your cancer is where. And now what now I realized, cancer now is like now your fingerprint. In the world, it's yours. The genes of your body is yours. So when you are operated, when I was operated in Aga Khan, and they removed now the part of my brains, And so they dried the brain so that now you have the block. Daktari knows about the block. So when you have that block, they go and tell you they are sending it to India or America, but that's not true.
They don't do it.
They don't do it.
That's a brave fight you had. And
Yeah,
let's
yeah.
bring in Dr. Kigondu on this one. Do you reckon that if public officials are forced to use public hospitals, then the facilities and the equipment will be improved?
Thank you, Trevor.
Sorry, I spoke too long.
No, it's all right. That's okay.
Kenya Medical Association is celebrating its silver jubilee this year in Mombasa, April 18th. And the association advocates for the welfare of doctors and the health of Kenyans. That's our objectives, the twin objective. The reason why Madam Zuleika reached that stage is because when she became an MP, all of a sudden, people were asking for money from her. I'm sure the Juja, every day, someone is asking for money for hospital bill, someone is asking for money to go to India, someone is asking for money. Going back 1 year ago when we were on the streets for 100 days, that is exactly what we were fighting for. Look at it simply. You want, when you wake up, the next door house, the next door hospital facility or health facility can treat you for whatever you have, be it cancer. You want it to have the ability to diagnose any disease that you have, because disease, whatever it is, whether big or small, it should not be there in human beings. And health workers are trained to do that. So the reason we are coming, Honorable Zuleika is coming to that, is because for so long, public health care has been neglected. And they are seeing it. And why that is the case is because there is a dichotomy between the people who are the akina muheshimiwa, who are supposed to pass money for the hospital, but they don't use it. As
because they don't use those same facilities.
As the Englishman said, you make your bed as you lie on it. So this is not saying that private facilities are bad. They are saying that if Mheshimiwa actually went to the public health facility, he would be with the people. He's actually seeing how they are suffering. He's seeing why the hospital is not able to treat what they have, and he would advocate for even more health workers to go there.
And more resources.
And more resources.
And I was speaking to Dr. Umoluga earlier on, and he called it health inequity.
Yes.
However, Honorable Sabina Shege has a different approach. She says that she would rather, instead of forcing all the public servants to go to hospitals, she would rather all the insurance be done by the government, so that there are no private insurances, so that every person is paid for their medical bill through NHIF. Would that be another solution? No,
actually not. Government attracts a lot of, how do you put it?
Red tape?
Tunawashuku. You get what I mean?
Yes.
The solution is to make the public health care system the same as the private, so that we are not deciding should you pay the private or not. If Mheshimiwa goes to, let me use Murang'a District Hospital, he should be able to be treated the same way as a private facility, and I heard he mentioned a private one that is. And that calls for investment in the public facility. Now we are arguing about the nitty-gritties of the how. That might not, if there is political will to say that in the public health care we will do this. And as Dr. Oluga has said, it's very simple, and the doctors have said, put the personnel there and then bring the equipment. Medicine is simple, personnel and equipment. In personnel, or what we have been going over and about is this thing of what we are calling, and maybe Mheshimiwa would join Moha of Nyali in advocating for a health service commission. A health service commission would ensure that all public facilities have the prerequisite personnel, both doctors, nursing, and all other allied workers, like people who operate the radiotherapy machine that he was in. Those are people not thought about, but they are required. But where do you get them? So we've been having this tussle between, is it national, and I want to correct Mheshimiwa, their health is not devolved. Health is a shared function. That keeping repeating health is devolved is what is causing a bit of problems, because eventually, and maybe I'll give him some homework to go and do, counties cannot manage the health workforce bill. The bill is too high, and it does not match with how people move up the job ladder in medicine.
And the need.
Today, yes, today you may have a doctor who is a medical officer. After 3 years, he wants to go back to school to further their studies, but he will leave a gap in the district. So if it's managed in a central mechanism, it's easier. If you manage at the county only, they hold on to him, and therefore he eventually has to resign, and you leave a gap, and you don't continue with the service.
All right, Honorable, you've actually won the fight against cancer, and you mentioned that when you were in India, you saw more legislators there seeking the same sort of treatment. Do you reckon we can afford the kind of equipment you saw there if we put the money, our money in the right use?
Yes. You know, I'm in Parliament.
Yes.
And they come there for demonstrations because after all, who is paying them? The county governments are paying them. That's why I'm saying health was not supposed to be devolved the way it is. 80% of it is devolved. But when they came to Parliament for demonstration, I was one of the people who went and took their documents to the speaker.
And took their petition.
Because I could understand exactly what they are saying. By that time, I didn't have my cancer, but I was going through whatever I was going through.
But can we afford the equipment you saw in India if we put our money to the right use?
That is now what I want to tell Kenyans. That even now, where are those machines that detect your cancer? Otherwise, cancer is painless. And now you can even stay 5 years, 6 years with stage 1 or 2. But it hasn't affected you. But where do you get that machine? Those are the machines we are not having. But when I went to India and I called here, the CS, and I said, which counties do we have this machine? 0.
All the 47,
and even
no machine.
Even one, the hospital I mentioned, and I don't want to mention the name again. If you go there, you see a big signboard showing that they know they can know about your cancer 100%. But the machine they have, it can't even tell you unless those which are in India and in America. The one that now, the hospital that I was in, first of all, they were telling me things that are not even true. But when I went to India, you are told, and I didn't know whether Kenyans know that, the cancer that you have, when the block comes, because my block was there, they said they had taken the block to America to show the cancer that I have, not even taking it anywhere. But luckily, somebody was coming to India but brought the block. So when it was put there in the computers, it exactly said, Francis Munyo Waititu, this is your cancer. And your cancer can't be my cancer, and the other person can't be their cancer. That is how it is.
Several times.
So that is now when you get the right treatment. And that is now why even now I'm not taking, after 7 weeks, I'm not taking any cancer treatment at all. But after 6 months, I'll go for another checkup there. But if I was in Kenya, let me tell you, what was now bad, even for our people there. If you go to Kenyatta National Hospital or any private hospital, the machine that you get for the radiotherapy takes a bigger area than what is supposed to happen. But those machines in India or in America, that's exactly where now your cancer is.
And we can afford
so I never even went with a wheelchair or went to any bed every day for 7 weeks. That is why now we are talking as a government, either county government or national government, unless now thousands and thousands of people, millions, are under cancer, but they don't talk. My constituency, when I spoke about it, now I have over 2,000 people since I came from, who are coming to tell me, and some from Thika, another from Ruiru.
Dr. Kigundu, there's another argument here that if all the public officials are forced to actually come to the public hospitals, then you'll be even overwhelmed even more. Because then right now people are saying you've been stretched. Kenyatta National Hospital, for example, says everyone goes there.
Machines are broken now. Sorry. I went there, they say the machines are broken now.
All right.
So first, let me correct Mheshimiwa a bit. The cancer detecting machine is the doctor.
But you do need equipment for that, right?
You see, now when doctors are taught many years of how to, they take your history, do examination, and recommend an investigation, you see. So where you come to purchasing machines is the third stage. And the person who will tell you which machine to purchase is the doctor. And therefore, going by what he's saying, I would urge the politicians to invest in human resource. For instance, like now, previously we did not have a lot of what we call I'm a gynecologist, meaning I treat women. Gynecology oncologist, meaning they are more than the gynecologist. So like, for instance, if I get, for instance, which is the most common cancer of the cervix, I will have diagnosed it till the end. Okay. But now for the specifics, the little details, I'll send it to the gyne-onco. So if they are not trained, then we do not have on them. On your point of machines, government can afford anything, only if they listen to the people who are asking them to buy. Or if they start
using the same machines, then they will know that they are needed here.
Yes, and if they listen, if I tell you to buy this machine, government can afford, but they need to listen to the health workers. And finally, when you go to a hospital and say there is no machine, government and by extension waheshimiwa are the ones who allocate money to the hospitals to buy. So if machines are broken in a hospital, then we look at
it's partly their fault as well.
Whose fault?
The politicians.
The politicians.
No. Once we do that, there is nothing we are supposed to follow again. Even the county money, we do the budget and give the money.
Zuleiha's argument is that you don't give sufficient budget because you don't use the same resources.
I think she's wrong, because this is my second term, and there is a committee of health, and what they do, they meet first and come and tell us, this is the money we want now, the whole parliament to pass, and that is what we do, because we know what is health and agriculture, those two. So what happens is, now who goes to oversight about that money? Parliament is not supposed to do that.
All right. We really have to wind up there. I see Dr. Kigondo wants to respond.
But before we wind up, there's something I wanted to tell Kenyans. When I was in India, I became the chairman. And when I became the chairman, there is Mangu High School, and many people know where it is. The owner of that Mangu High School has given us a land, 100 acres worth 29 billion, where after the daughter passed on, he wants to give us and build a school. I mean, a hospital. And again, in India, they won't come and build a hospital there. That is why we are saying God is with us Kenyans. Because now things that are happening, even the president, and I also met our former prime minister, Raila Amolo Odinga, who I want to meet again, so that at least we work as a team. So many people should come out clearly and say, I have cancer. Don't hide about cancer.
We really have to
talk about cancer, and I'm sure things will be fine.
Dr. Kigondo, I know you want to give in one last statement, just very briefly, because we have to run out.
I would advise them to invest in the health workforce and the push for a health service commission, because the health workers are the cancer diagnosing machines. And then they listen to health workers on what to buy. Like we know exactly which machines he's talking about. If they only listen to us. And that's my...
And the governors, when the president really buys machines for them, don't refuse them. Remember, he took machines and they refused.
Dr. Simon Kigondo, practicing doctor and KMA treasurer, and Honorable Francis Waititu, Juja, member of parliament and also a cancer survivor. This discussion continues on NTV Today tomorrow with Victoria Rubadiri. They'll be talking about the dynamics around investing in health care. But